above the age of 18 years, which is the legal age of Nigeria, as well as families who have at least 3 children. Families of at least 3 children between the age of 0 to 10 years. Also, the inclusion criteria is that people need to have generators in their homes for at least 1 year, because the exposure to generator fumes varies depending on the period of exposure to generator fumes. Also, participants needed to have generator in their generators to be able to collect the first samples, which I will further explain as we go on. The study setting was done in Enugu State, Nigeria, in Abakpa, Charalega, and New Haven. Why I chose these district areas is because they are both recognized as being commercialized and residential areas. This is an exploratory quantitative case study because it helps to identify, or we are trying to identify the presence of lead, which has not been done in other case studies. Then I collected my data. I selected my participant based on random selection of the participant, as well as incorporated random snowballing, which helped me to identify hidden populations among the commercialized areas, which are also known as rural areas in Nigeria. To ensure the human subject protection, I first of all applied for my Institute Review Board, which requested me to obtain an ethical certificate, where I learned a lot, especially about research misconduct, confidentiality, and anonymity of the participants. Also, the eligibility criteria, which I initially stated, the identity card, I presented my identity card because most of the individuals were reluctant to open their doors, thinking that this was a governmental project. So I had to ensure them that I made them feel safe that my project was a project for my graduation, that this was my thesis project. So I presented my student identity card. While collecting the data, I presented or administered informed consent to explain to them about the objective of the study, the benefits and the risks. The confidentiality, well, the questionnaires were recorded using numerical coding. That is, I used the abbreviation of the district area and the number of the householders interviewed per day. Also, the questionnaires are being, or the structured interview guide are being stored in a password-locked laptop, as well as the cabinet of the Environmental Health Center in Cluj-Napoca, Romania. Training, which was done by the National Drug Abuse Treatment Clinical Network Trials. The certificate is known for good clinical practice. Then I developed my materials, which are structured interview guide. The participants were recruited in their various homes. This was a door-to-door interview, and this was a door-to-door interview. So I avoided participants from seeing the questionnaire, as well as because I had questions that wrote possible health symptoms of CO. They might think that those were related to the types of health symptoms, but I used this as an interview guide because I didn't want them to know that I was asking questions based on the health symptoms of carbon dioxide or lead. Also, flyers, I gave them access to information based on the recommendation of the location to use the generator, as well as possible health effects of the use of generator. There were 2 forms of training during my data collection while I was in Nigeria. I trained the volunteers in the recruitment and the study objective. Each day, 2 volunteers accompanied me. These volunteers were derived or were assigned to the project by New Millennium Foundation, Enugu State, Nigeria. These volunteers accompanied me in order for the participants to feel open to me. Because I'm of 21 years, they'll think it's insulting to them that a 21-year-old is coming to talk to them. So having participants from the age of 30 to 40 made them more open to me and made them more open to the questions that I was going to ask them. Also, I trained the volunteers based on the study of the study objectives. I told them that this is the objectives of the study, and as well, I told them that they had to do the first introduction of the study when contacting the participants, but they had they didn't have access to the questionnaire. Training of the lead investigator, I was being trained by the Department of Petroleum on how to collect the first samples, which were collected after each interview from the respective generators of the household. My data collection, like I said, my participants were recruited door to door, so in their various homes. This was a face-to-face interview. I incorporated snowballing because it was an easy way to have access to hidden population, given the fact that Abakpa naturally are known to be commercialized areas, also known as rural areas. I collected my first samples for each household that were interviewed, and the full analysis was done by the Department of Petroleum. Air quality, the relationship between the awareness of the individuals, that is their knowledge, and the location of the generator, as well as find the relationship between the use of generator and the perception towards the indoor air quality. I used my chi-square to also determine the relationship between how these individuals use the generator and the possible health or self-reported effects or symptoms from carbon monoxide and lead among children and adults. This is a chronological flow of my study. Data measurement. This table is the results from the Department of Petroleum. This shows that lead is still being present in the use of production of gasoline in Nigeria. The Department of Petroleum has a national limit of 50 milligrams per liter of lead that should be present in the gasoline. Actually, it has indicated that 2.80 milligrams of per liter is still present in the fuel from that respective district area, as well as New Haven, Enugu, and Abakpa, Nike. And these samples have a difference of 1.90 from the national limit. Therefore, this has indicated that lead is still being an additive in the gasoline production in Nigeria. The location of the household. This is an important variable because the structures of household in Nigeria is different. The entrance passage is through a balcony, and this is where the windows of the bedroom faces, as well as the windows of the living room. The participants have an average of 51.7% of the participants indicated having their generator placed in the balcony, while 31.7% indicated that their generator were placed out. They do not know that generator actually influences the health, while a very few percentage of individuals indicated that there was no form of association between the use of generator and the quality of health. This is the statistical test. I used chi-square coefficient to find the relationship between the behavior of the use of generator and the possible or possible self-reported health-related symptoms of carbon monoxide among adults and children. It has been proven that the use of generators in hours, that is how much hours these people use their generators while they're indoors, can influence or increase the crisis of the medical diagnosis of these participants at a significance of 0.00. While people who self-reported having health symptoms among adults in their household has a significance of 0.004 association between how they use their generator while indoors. Participants or adults reviewed they had an industrial generator for all units. The use of power generator. This graph here indicates the behavior of how these participants use the generator. Very often means every day per week, often means 3 days per week, not often means once per week, and never means that they never use their generator in their respective homes. As indicated, 66.7, which is an average, which is the average or maximum number of participants who use the generator often compared to those who use the generator 26.7% more often. Then 50% of the participants use the generator not often, and no one uses the generator, or rather no one never used their generator, or indicated that they've never used their generator. This graph here shows this side of the graph shows the number count of individuals that use their generator per hour. Here, 20.3% of the individuals has indicated that they use their generator 5 hours while indoors, while 16.9%, that is 10 people, indicate using their generator for a maximum of 4 hours. The people who least use their generator have the least number of hours of using their generator while others, and that is people below 5. That is 6.8%. While 11.9% of the individuals have indicated that they use their generator for 8 hours, for 8 hours while being indoors, as well as 10 hours. And then the rest have the least numbers of hours, rather, the least people have the highest numbers of hours of using that generator. To be able to ask Nigeria, and it still poses as an environmental health threat among the users, especially if there's a presence of children. People who express their opinions can or are most likely to inform other people, as well as lead is still being used as an additive in the production of gasoline. The limitations of the study is that the study had a majority of educated people, and also